We're just giving folks a little bit of time to migrate through the Zoom tube that brings you into this room. Welcome back for what is our final installment of the Gender Equity Education Series for the 2022-23 academic year. We're really excited to have you here and so happy to have two great speakers, one local and one that we've brought in to talk about anti-oppression facilitation skills. As some of you know, we've been talking about safety in all of its forms during this winter and spring portion of the Gender Equity Education Series. And so we're really happy to round it out by talking about safety in groups and how we can apply that to our workplace. So thanks to Steve Berns, Dr. Steve Berns, our own superstar, and his colleague, Dr. Lindsay Dow. I would like to acknowledge Dean Page, who's one of the great supporters of diversity, equity, and inclusion in our community, who's here anytime he's in town, even if he's got other really valuable competing interests. So Dean Page, I'll pass it off to you.
Thanks very much, Dr. Doherty. And I just want to say hi and provide my support to this important series and today's event, and selfishly just listen in. I do have family in town, so on top of jeans, I've got a shirt and tie for this event. As I emphasize the importance of our efforts around diversity, equity, and inclusion, and the fantastic job Dr. Doherty has done in terms of the Gender Equity Steering Group, these events, these educational events are so valuable to our entire community and are educational and make us better. So from my standpoint, I just want to say hi to the fellow who's barking in the background, and to all of you. That's the beauty of this, to all of you for taking part in this, and express my appreciation to the committee, the organizers, our visiting speakers, and our home speaker. And just with that, I'll get out of your way and enjoy listening in and learning with all of you. Everybody stay well.
Thanks so much, Dean Page. And my apologies for my dog who wants to be part of the conversation always. I just have a couple of nuts and bolts before I hand this off. We have a Gender Equity listserv that you can subscribe to. Great way to know about upcoming events. Emily is going to put that link in the chat for us. Also, we've got closed captioning as per usual that folks can access if they would like. And we're going to be recording this session, and in a couple of days it will appear on the ODEI video library. So again, Emily is going to put that link in the chat. There are tons of recordings there, so if you miss one of these events, they're all sitting there. Take advantage of that resource. And so now I'm going to pass this off to Dr. Molly Berry, one of my colleagues who is on our Gender Equity Education Working Group. Dr. Berry is an associate professor of medicine in the Division of Hematology Oncology, and she's the director of the Hem-Onc Fellowship Program. And I've enjoyed so much putting these series together with Dr. Berry, and this was one of her babies. So I'm going to pass it off to her so she can introduce our speakers.
Thanks so much, Dr. Doherty. I am excited to welcome Dr. Stephen Berns and Dr. Lindsay Dow today for our final Gender Equity Education Series talk of the academic year, Anti-Oppression Facilitation Skills, Removing Barriers to Participation and Disagreement. Dr. Berns is an associate professor in the Division of Palliative Medicine in the Department of Family Medicine here at UVM. He wears many hats, including site leader at UVMMC for Palliative Medicine, program director for the Hospice and Palliative Medicine Fellowship, director of Talk Vermont, and course director for the Professionalism, Communication, and Reflection longitudinal course at the Larner College of Medicine. He received his medical degree from the Icahn School of Medicine at Mount Sinai and completed his residency in internal medicine and fellowship in hospice and palliative medicine at Mount Sinai as well. He was on faculty there before we had the fortune of him joining us here at UVM in 2017. Dr. Lindsay Dow is an associate professor of geriatrics and palliative medicine and associate professor of global health at the Icahn School of Medicine at Mount Sinai. She received her medical degree at Virginia Commonwealth University Medical School and completed her residency in internal medicine at Montefiore and Albert Einstein College of Medicine and fellowship in hospice and palliative medicine at the Icahn School of Medicine at Mount Sinai. Thank you both for your participation today, and we're so excited to hear your talk.
Thank you for having us. I'm going to go ahead and share my screen.
Thank you all for the welcomes. Thank you, Dr. Doherty, Dr. Barry, Dean Page. It's such an honor for both Lindsay and I to be here. And we are so grateful to share what we've learned and what we try to practice on a regular basis around anti-oppression facilitation skills. And the piece that we'll acknowledge is the focus of today is really providing you with some skills on facilitating either in the classroom, but also in your administrative meetings. And there may be some takeaways that you can extrapolate, even if you're a participant.
So we have no financial disclosures, and at the same time, we do want to acknowledge that the facilitation pedagogy that we're going to present today is primarily adapted from two resources, from AORTA, the Anti-Oppression Resource and Training Alliance, as well as the organization Teach Like a Champion.
And so we would like to accomplish 3 learning objectives throughout the next 45 minutes. And so hopefully by the end of the 45 minutes, you'll be able to walk away with recognizing the oppressive forces that still exist in our meeting spaces and appreciating how to maximize equitable engagement in small groups and practicing how you might remove some of those barriers to full participation. And our final objective is describing the importance of disagreement and naming some skills that will help promote and highlight disagreement in small group settings in a kind and safe way.
So before we do this, we want to acknowledge the big picture of what anti-oppression facilitation is. The idea behind it is that you're trying to enhance participation so that really everybody gets to participate and share their ideas, not just those in the room who might feel most comfortable speaking up. It's also to enhance voice equity, really working to prevent or interrupt the attempts by individuals to overpower the entire group or all of the rest of the people in a room. It's meant to balance power, so keeping an eye out for social power dynamics that exist and then working to interrupt them. And helping to achieve true group decisions, having the group come to decisions that are best for the whole group, rather than just 1 or 2 people's personal preferences.
To start us off, we would not practice good anti-oppression facilitation skills if during this webinar we didn't share a community agreement. And so we wanted to share some expectations or some ways that we can be engaging together. So first and foremost is we invite all of you to participate, and that would be through the Q&A, and we'll have some ways that you can ask questions and ways that you can participate using the Q&A function of this webinar.
So along with that, we want to acknowledge, as you all are participating, that nobody in this room knows everything, especially and including the 2 of us. However, together, all of us know a lot. So we welcome everybody's voice.
And if you're someone who tends to be quieter or tends not to share through the chats, we invite you to move up into a role that might not be your usual and to actually say something in the chat. And for those that often speak a lot or use a lot with the chat function, we invite you to move up in a different role and sit back and listen to some of your colleagues.
We also want to acknowledge that we all can't be articulate all the time, so it is very okay to share ideas that are not yet fully formed. And it's also okay as we practice to stumble or to mess up and make mistakes.
And we invite you to be curious and to ask questions from a place of curiosity. We'll have a little bit of disagreement exercises where we'll explore where our disagreements may be coming from. And so please think about wearing your curiosity hat today.
So along with this, these are some of the ideas we've created to help everyone practice and participate in today's session. We also welcome anyone to add things to the chat that would help to make this a space where they feel comfortable participating. So go ahead and add anything you like. And as you do that, we're just going to go into why anti-oppression facilitation skills are important.
So before we talk about some of the individual skills, we really want to take a moment to talk about why this is important for our community and for our trainees and our colleagues. And again, to be mindful of facilitation skills as the background. But before we talk a little bit about why we are here, we really wanted to get a sense from you all about what you've noticed as barriers to participation. And so in the Q&A section, this is our chat for the webinar, we want you to think about our recent experience as a meeting participant and to think about one barrier that hindered the full participation of all group members. And the way we're going to do this is called a chat waterfall, which has 3 steps. The first is that you will then think about what you're going to write. And so we'll give about some time for that. And then you're going to write it, but not press send. Now, this really works if you're in a not Q&A form and you can see everyone's ideas, because this way ideas aren't always influenced by the others and people can feel comfortable expressing their own personal ideas. But for this one, we'll practice that chat waterfall through the Q&A function. So again, think about one barrier that hindered full participation at a recent meeting you were at. We'll give you about 30 seconds to think about it. And when you're ready, you can start typing, but don't press send just yet. And again, use the Q&A feature for that. And now we invite you to press enter and we'll create a waterfall that only Lindsay and I can see. But Lindsay will help narrate some of the suggestions that you all mentioned.
I see multiple people acknowledging the fear of being shamed or fear of belittling. Acknowledging events that might take place outside of work hours or off-site where they might not be accessible by everyone. And acknowledging the response of facilitators when they share something that is different than what other people are thinking.
Thank you for all those barriers, and we'll explore these barriers together from the literature. But before we talk a little bit about what the literature has shown, Lindsay and I wanted to share our journeys and how we got here. And so I wanted to introduce me as a PCR course director. And when I first inherited PCR, I always felt that students felt comfortable enough to share in those spaces. And this is actually Dr. Berry and I co-facilitate our group, and this is our group that just graduated last weekend. And for those of you who are unfamiliar with PCR, it stands for Professionalism, Communication, and Reflection. It's our course that focuses on the humanism aspects of medicine, and it does it through small group process with 1 or 2 facilitators and 8 students, talking about sometimes some challenging topics. And the goal is for students to take risks and to question things. When I did a study about our safe spaces in PCR in 2020 and 2021, and then repeated the year after, we found that 1/3 of our students still did not feel comfortable enough sharing what was on their mind in PCR. And some of the reasons that they shared were sometimes the facilitators didn't have the skills to navigate particularly conflict or emotional topics. The other piece was that they felt other students often weren't listening to them or would interrupt them. And so this really made me think about how can we do better here at Lerner College of Medicine for PCR? And unfortunately, this is not new to medicine in general or the medical student experience. And having spaces feel unsafe for our learners as well as our faculty. And this is actually some results from the recent or the 2021 GQ survey, just looking at the learning environment in general. And to this day, 40% of students still experience public embarrassment. And even 22% of students talk about that being public humiliation. And other questions that they got at were about 16% of the students felt or were subjected to offensive or sexist remarks based off of their gender identity. And about 10% were subjected to racially or ethnically offensive comments or names. And some studies looking back at why or what's going on found that our Latinx, our Black and Indigenous students, as well as our LGBTQ students, had a 5 times fold higher reporting rate for experiencing discrimination and public embarrassment. And they connected those to feelings of isolation and lower mental health quality of life. Unfortunately, this doesn't stop with medical students and continues on in residency, where our trainees do not always feel safe in our spaces. So a recent study came out in JAMA where they surveyed over 21,000 internal medicine residents, and 62% of them reported seeing mistreatment, while another 40% said they were received mistreatment themselves. And internal medicine residents weren't alone. There was a study that was published in 2019 in New England Journal of Medicine that looked at 7,400 surgery residents, and they actually did it timing for their oh my gosh, I'm gonna lose my train of thought, so bear with me. I just want to make sure I get it right. They did it with their training exam. And they found that 32% of surgery residents experienced discrimination based on their gender. And they also found that 17% experienced based off of their race discrimination. And these were associated with lower mental health quality of life, some thought about suicidal rates or ideation. And so certainly these unsafe or less safe spaces have their impact on residents. And we could actually repeat the same studies in our other trainees and other professions, as well as our faculty and our staff. So we really need to do better.
Medicine is also not alone in this. About 10 years ago, there was a study of 1,100 female executives, and it was found that over 50% of them really didn't feel their voice was heard, specifically in the meeting context. They actually surveyed 7,000 people total. They surveyed their colleagues as well, who experienced the same thing. They also felt like their female executive colleagues' voices weren't being heard in the meeting context. In 2017, it was also noted that amongst Supreme Court justices, female justices were interrupted when they were presenting 123% more times than their male colleagues. This dropped in 2020 when court arguments were done virtually, and by the nature of that, only one person could speak at a time, and bumped right back up when things returned in person. So bringing this back to our story and our why, I can't present with Steve in this setting without acknowledging that we met 10 years ago when he was my first attending as a palliative care fellow in 2013. And Upon graduation, we became close friends and teaching partners, and we realized that we were both really interested in how to make teaching, especially small groups, more engaging. And so this is a picture from one of our book clubs, probably around 2014, 2015, where us and one of our nurse practitioner colleagues would meet on Sundays and read Teach Like a Champion, which is a book and now a bigger organization, which thinks about how to make K through 12 teaching more engaging. At the same time Steve was doing his PCR work, I also am a part of our medical school curriculum committee and was at one of the meetings where I found out that in one of the preclinical courses, the small group evaluations had significantly improved, and that the reason for that improvement was that all of the facilitators had gone through anti-oppression facilitation training. And so I was intrigued and initially accessed some of the training through the medical school where I worked. But this brought both Steve and I to the organization AORTA, the Anti-Oppressive Resource and Training Alliance for further skill building and training. And so we just want to acknowledge them because that's where we've taken a lot of courses and grown a lot of our own skills, and want to acknowledge that the idea behind this is that AORTA really wants to bring an intersectional analysis of systemic oppression and movement building through facilitation and other mechanisms like training, coaching, and organizational consulting. And the idea is to really disrupt the hierarchies and power that exist in, as Steve just presented, all of our spaces in medicine, as well as outside. So there are many skill sets that we could present. Today, we're going to give two small bites. So we're going to talk about two skill sets. The first that we're going to focus on is removing barriers to full participation in a group, and then saying yes to principled disagreement or allowing for different viewpoints. So you all acknowledge some of the ways that we might limit full participation in a group. And we're going to share some of the others. One of the ways we do it is by asking really broad and open-ended questions that can feel too big to answer. We often implicitly ask for fully developed opinions. Many times, and I am guilty of doing this too, we rely only on volunteers for input or the first person to speak up. We don't always create different ways or multiple ways for everybody to offer their thoughts. And we don't always create clear channels that allow for disagreement to surface. So we're going to talk about how to do this differently. Where we want to start is is a way in which we started today. I think it's really important to create community agreements within a space, and not just doing this once at the beginning or only in a classroom setting, doing this frequently or doing this often in all of our spaces and checking in on those agreements every time you meet. It's really not about creating rules. It's about creating expectations and a space that allows everybody in the room to participate. So the three strategies that we're going to present today for fuller participation. One is how to create multiple and varied channels for participation. The next is shrinking the ways that people participate and keeping it right-sized. And the other is building a gentle ramp for full group discussions. So building up to those really big, huge questions that may feel like they need a more definitive answer. So first, we're just going to share some of the ways to open multiple channels for participation. One of them Steve modeled when he asked the question about barriers to full group participation. Rather than having everybody share their thoughts immediately in the chat, he did something called silent solo writing, where people had about 30 seconds to form their own thoughts before sharing, so that number one, they're not influenced by everything else in the chat. They're also, their own thinking isn't shut down. So after asking a question, giving a moment for everybody in the room to think, knowing that we all think at different speeds for different questions. Another option that many educators in the room are probably already familiar with is pair and share, so that people don't feel like they need to share in front of a large group of people, but might feel more comfortable sharing with their colleague next to them. It also allows for everybody in the room to participate versus only one person at once. Snowball is a technique that can be used to share anonymously, everybody writing their thought down on a piece of paper, crumpling it up and throwing it into the center of the table. And then using Post-its, flipboards, putting them around the room so people can put their thoughts in different areas for different questions or topics. Or having an open mic in a meeting or a dedicated space where the facilitator might say, what agenda items would people in the room like to add, and also giving it the time and space that it needs versus maybe 2 to 5 minutes at the end of the session. So these are some things that work in person, can also be done in the virtual setting, but specific to the virtual setting, the chat can be really helpful. Pair and share can be done in breakout rooms. And then there's other functions that might allow for both anonymous participation like polls, or for everybody to contribute, whether it's using the whiteboard function on Zoom, things like Jamboard or Slido. So now what I want you all to do in the chat is I want you to share on a scale of 1 to 5, how you feel about being asked an open-ended question, from 1 being that you hate it, to 5 being that you love it, or 2 to 3 to 4, somewhere in between. So I'm going to have you share that in the chat now.
So Lindsay, it looks like we have a few 4s, some 2s, some 3s. So far, no one with very strong convictions, either 1 or 5, have been who said anything. But it looks like if we could average it, it is somewhere between a 3 and a 4.
All right, so somewhere in the middle. And we are asking this question because we realize that this can go in both directions. I think many of us in the room have learned in our clinical training that open-ended questions are great. Don't lead the person to a specific answer. On the flip side, open-ended questions can feel really big. And so both in the clinical context as well as in meetings, sometimes you need to build up to it. And Priya Parker, who wrote the book, The Art of Gathering, that thinks about really deliberate approaches to bringing people together in a room, says that in a world of infinite choices, choosing one thing is a revolutionary act, and imposing that restriction can actually be liberating. So we're going to talk about how to make participation right-sized, as well as how to build up to it.
So keeping this in mind and how overwhelming open-ended questions could potentially be, sometimes limiting the kinds of answers or getting people to focus on the answer type can feel more liberating, as Priya Parker mentioned. So we'll share 3 types of skills here. The first is options. And instead of asking that open-ended question, giving people just a few options to answer. And so Lindsay demonstrated this with a scale of 1 to 5. But another way to do that is you can ask a yes, maybe, and no. And then once you got the majority or heard from majority of folks, that's a great way to sort of weigh where the group's at and then start exploring those answers. The next option is limiting by length. And this could be asking people to either have 1-sentence answer or 1-word answer, or asking them to give 1 example. So in the example here, we say, what is 1 strength or what is 1 challenge? And the final skill is making imperfect lists. Often during brainstorming, we all feel overwhelmed, or we all want to say another comment about why we suggested something. And instead of going back and forth and hearing ideas, having them sort of an idea dump and making imperfect lists. So we can say something, let's take 1 minute to come up with as many examples of why we should require attendance or not require attendance. And just getting all those examples out there without talking through them and then hearing and discussing after all those have been exhausted by the group. And so some examples of right sizing with common meeting questions. 1, instead of asking, what questions do you have, or any questions, you can try, what is one question that's coming up for you right now? Another example is saying, are there any insights you have or any ideas? And changing that to something that is more, what is one thing that excites you? So it gets at the emotion aspect, or one thing you're worried about. Sometimes those are easier to answer because there's some charge around the emotion. And the final piece is, how does everyone feel about that? Sort of, you make a big change, or there's a big change happening, and you're like, how does everyone feel about that? Sometimes you may not get the answers that you, or I would say answers that are forthcoming, perhaps. And so some suggestions about that are, one, vote with an emoji and see what your group is saying on a Zoom call. So voting with an emoji or a gesture. Another is you can say, what's one feeling that comes up for you when you hear this change? Or what we did was doing a 1 to 5 scale and seeing where people are at. So the next skill is building a gentle ramp. And when I was taking the aorta course, this is the hardest skill. So we're going to break this down into some components. The idea behind this is that when we start with a big question, it can be overwhelming and may take a greater cognitive load. And so what aorta suggests is actually come up with a gentle ramp where there's easier questions that work towards the big concept you're trying to get at. And so I observe questions are sort of the most basic, which is usually what people are seeing or what they are observing in themselves. And this is just factual. Am I familiar with this? Yes or no? Or looking at this map, what am I noticing? And I feel question could be a little bit harder. And this is someone's reaction to something or what they feel is going on for them personally, or perhaps for patients. And so this is asking about that feeling that can help really get them charged to set up for that big, I think question. And that big, I think question could be where it's more complex, where they have to work through the answers that they had before and then answer the I think question with that help of the gentle ramp. So one thing to think about is order does matter when it comes to asking questions. So being very thoughtful of that. We suggest don't start with the big questions. And if you're designing a meeting or designing a curriculum, work backwards. Work with the big question and then think about the questions that help you lead to that can help you tackle that. And the final piece that we'll say, we'll keep in mind is that this building a gentle ramp really can work warming people up. And so I'll give you an example that I used for PCR. So my big question in a PCR curriculum was, how do you think the Supreme Court decision will impact healthcare? So thinking about the reversal of Roe v. Wade, really big question. And maybe not everyone has the same knowledge about that. And so it worked backwards. And the first question thinking about for the I observe is, how familiar are people with the regulations or access to abortion in the US, or maybe even locally in Vermont, and starting with that. And then the next piece is using some sort of data in front of us, looking at the map of the US with current reproductive rights. What do you notice? How did this change with the court decision? And then moving forward with the I feel questions, what is one feeling that came up with you after you heard the decision? And then what is one feeling that comes up for you seeing the current access? And then by building those up, it hopefully will help set up people to answer that bigger question. So Lindsay and I are going to have you practice just coming up with what I observe and what I feel question. So we're going to focus on this big question. Why do you think the US spends the most money in healthcare and yet has a worse health outcome? So you can think about longevity, you can think about maternal health, infant mortality. So you can think about so many markers here, but thinking about that general question, and it's big. So we want you to take about 30 seconds to come up with an I observe question. And we'll sort of chat waterfall it, give it 30 seconds, and then we'll ask you to put it in. And again, an example of I observe question could be, what are you familiar around X? Or what have you noticed in your clinical practice, as examples. So again, put those I observed question or think about it, and then we will have you put it in the Q&A. Again, the Q&A section, not the chat section for a webinar. And hold on to those ideas. Yeah. Okay. For those that are ready, think about what observed questions did you come up with, and feel free to put it in the Q&A. And Lindsay will sort of read some highlights.
Thank you, Rob. What is your familiarity with the trends in life expectancy in the US? How do you see the relationship between healthcare and money play out in your specific work?
Love it. So now we'll move on to an I feeling question. And for you to think about an I feel question, so we'll give you 30 seconds to come up with an I feel question. So this could be an example of, what do you feel when you look at the statistics? Or what do you feel when you notice your patients go through this, as some examples. And again, 30 seconds to just write it out, and then we'll have you put it in the chat or the Q&A. All right, and when you're ready, feel free to put those I feel questions.
I love this. Where do you feel your community's priorities lie when it comes to the financial aspects of healthcare? How do you feel when you notice that your doctor can provide, that the care your doctor can provide is restricted by the type of health insurance? And what do you feel contributes most to the differences compared to in the US compared with other nations?
Love those. Thank you for those examples. And now Lindsay will bring us to the next skill set, which is around allowing for disagreement.
All right, so in the Q&A, I'm going to have you all just share. You don't have to wait 20 seconds this time. Just share what is one thing that we would gain if we disagreed well in our meetings?
So I'm hearing some fantastic answers, hearing different ideas or more perspectives, a new understanding around issues, the opportunity to re-examine one's own disposition, and a more cohesive working space.
All right.
Safety increases.
So it sounds like a good idea. The question is, how do we allow for it, which isn't as simple. So we're going to start with some of the ways that we get in the way of allowing for disagreement. And you all shared some of these at the beginning. We avoid disagreement by focusing on alignment and similarity, which is a lot more comfortable. We sometimes allow for disagreement to occur in a series of monologues rather than an actual discussion where we respond to one another. An example, Steve and I were thinking of this, the most extreme example is when you're at a conference session and everybody lines up at the microphone and is ready to say something and say their piece, but really aren't listening to the other people. And I've experienced this in the last 5 minutes of discussion in a meeting as well, where everyone is bursting at the seams to talk, but not talking at each other or with each other. Sometimes we gesture towards disagreement and say that we want it without having an actual channel or container to hold it. So when we leave like 2 to 5 minutes at the end of a meeting for this versus giving it its actual space to deepen a discussion. And then people mentioned this at the beginning. Sometimes the way that people are responded to who express disagreement is in a discouraging way. And it can range from irritation to dismissal to even punishing and shaming. And others just dismiss disagreement as interpersonal beef or nothing relevant to the full group or the full group discussion. And so we're going to talk about principled disagreement, which is really inviting, turning towards, and spending time in our differing views. And the idea behind this and the reason is to really deepen our relationships and the power of our collective work. So similar to the last skill set, we're going to present three strategies that might help with and allow for principled disagreement. So the first is setting the stage for it. The second is really making different perspectives easily visible. And the last is breaking up this monologue flow. So in terms of setting the stage, again, having a reminder of the community agreements frequently and often. Really being clear in setting your own purpose and potentially creating a shared purpose within the group of the meeting. Modeling vulnerability that you don't have all of the answers. And considering an icebreaker, either one that highlights that we all have different opinions in the group, like is tomato a fruit? Or one that if it's a group where everybody doesn't know each other well, allows for people to get to know each other better.
So the next skill to think about is, especially when you feel that your group probably has similar ideas or is on the same political spectrum or all have similar experiences, life experiences, is to really make different perspectives more easily visible. So the first one is actually scaling it. And Lindsay and I actually already did some of this with you. And that's asking a question and asking people to rate it 1 to 5 with an absolute yes versus an absolute no. So an example here is, where are you on the scale of 1 to 5 on Medicare for All? What is fascinating is, even if your group ranges from a 3 to 5, the differences that people share from a 4 to a 3 and why they selected it can often help highlight different perspectives and make those differences visible to help us better understand a topic. Another way to do this is helping people do some perspective taking, or helping your group do some perspective taking. And you can ask this in a bunch of different ways. You can ask them to imagine, what would a colleague who's on the other side of this issue say about this? Or getting people to go to a what if. So what if we took away these resources? What would that look like? Another way to do this is thinking about deepening difference. And this is really, once you, for example, heard a scale of 1 to 5, asking people to share what was behind that answer. Or if you hear something that maybe someone just mentioned in their talking point, like, I wish things were different, and you're like, wow, that's really interesting. You can ask, hey, Lindsay, do you mind just sharing what you meant by I wish things were different? Or what's an example of that? And the final skill here is, feel free, especially if the group has worked through difference before, feel free to challenge each other and ask permission to challenge. And so an example of this is, hey, can I challenge you there for a second? The next skill in this is really breaking up that monologue. And as Lindsay mentions, that is, if people are just lining up to say their piece, how do we make sure that people are actually engaging and listening to each other? So there are 3 skills we'll talk about here. One is calling on the differences. So for example, calling on someone who gave a 1 and calling on someone who gave a 4 and asking them to engage with one another. Another example is connecting ideas. So instead of saying, what other idea do you have? Asking folks to say, hey, we just heard Sunny echo, Sunny, I heard you echo some of what Dara said. Anyone want to build on that? So really getting the next person to connect the ideas so that you can enrich those perspectives more and people can actively listen to each other. And the final piece is that container piece, and really giving specific instructions about, we're going to have 15 minutes to really talk about this. And sometimes you could do a step back process. And in palliative care, sometimes we'll have someone bring up a problem and then they step back and are not part of the discussion, and they actively listen, because we often know that when someone brings up a problem, the power dynamics of them influencing the discussion could lead to an answer. And so getting that person to step back and just listen can really be helpful and create a more robust conversation. So we're going to practice this. And so we're just going to acknowledge that this is a confidential space, that we're going to now engage in disagreement, and it's okay to be uncomfortable and to be imperfect with your answers. And so we're going to ask a question that may cause some disagreement, and that is, what is your favorite dairy treat? Or what, in your opinion, is the best frozen dairy treat? A creamy versus an ice cream. And so on the scale of 1 to 5, if you are team creamy and absolutely that is the best, pick a 1. And if you are team ice cream, pick a 5. And as Lindsay mentioned, if you lean on a creamy or you lean on an ice cream, pick 2 or 4. And if you're absolutely neutral, pick a 3. So invite you, once you have your answer, to put it in the Q&A, and we'll look over some of these answers and perhaps call on some folks around that. Amazing. So a couple of folks, really amazing. So there are a couple of people who picked 3s, a couple who picked 1s and 2s, and a couple who picked one who picked a 5. So I invite those that said team creamy, and I don't know how this is going to work in the webinar, but feel free to unmute yourself and share why you picked a 1 or a 2. And if you can't do that, just put it in the Q&A and we'll read it out loud. Okay, if you can unmute, just put your rationale in the Q&A. But this is a really great way to actually engage and ask people to share. And so we'll just ask you to share some of your rationales. So I love it. So some people picked a 3 because they said they don't even know what a creamy is. I've never had a creamy, so hard to know. One group member said all dairy treats are equally important to be ingested. So someone who is quite neutral. Anyone who's a 1 want to share their rationale? Or a 5? Yes. Then ice cream has a more variety of different flavors than creamies do. And another mentioned the texture of both are great, but the texture of the creamy is slightly better. So thinking about texture. So fantastic. Thank you for being part of that discussion and doing an exercise around disagreement. So our last thing we just want you to walk away with and think about is, we just talked about facilitation skills if you're leading a meeting or leading a classroom discussion or small group discussion. But sometimes you aren't leading. And so we wanted to have you think about 3 sets of skills that you could do to promote engagement and promote disagreement at times. So the first is engage with warm calling. And there was actually someone who is currently on this webinar who did that during a meeting I was in, noticed I was quiet, and turned to me and said, Steve, I'm noticing you're doing some thinking. Do you mind sharing what's on your mind? Sometimes you can ask for different perspectives. And I've been on the MCC where all the faculty have spoken and we haven't heard from a student. And warm calling, I would love to hear from a student right now or a staff member to hear what your perspective is on this topic. So that's engaging other voices. Another one is opening channels with an ask. So if you're noticing you're doing the same old thing, the same people are answering questions, ask permission. Would it be okay if we wrote our answers down first? Or I have a tendency to really have sort of word fumble when I say something out loud. And so I'll share sometimes, hey, sometimes I need a little moment to think about the question and write it down before I answer. Would it be okay if we have 30 seconds to do that? Or can we take a brief parent share to talk about our experiences to help change things up? And the final piece is really thinking about calling out or redirecting behaviors that are oppressive. So there are a couple ways to do this. For example, when someone is interrupting and you notice they're being interrupted, you can say, I would like to hear what Charita started saying. It sounded like that was really interesting. Or you can call out softly. So this cartoon from NPR's Life Kit in 2021, they mentioned, one person was sharing, I think we should focus on, and another person interrupted and said, actually, I had an idea that might fix that. And the person who was interrupted said, oh yes, Ralph, I would love to hear what you're saying. That actually relates to what I was just about to say. And so thinking about calling out, but maybe not in an angry way, but in a way like, oh, yeah, I would love to hear what you're saying. Can we bring it back to what I was going to share?
All right. So before we open this up for questions, we just wanted to give an overview of the two skill sets that we hope you all can take some pieces of carrying forward. We want to ground this in the big picture that the oppressive forces that exist in our society, of course, exist in our meeting spaces as well, and that anti-oppressive facilitation skills really seek to empower the group as a whole and to actively counteract some of the exclusion and hierarchies that exist because of these oppressive forces. We hope that you can try some of these strategies to removing barriers to full participation and can encourage some principled disagreement in your future meetings. And we wanted to close with another Priya Parker quote. She acknowledges that a gathering starts long before guests walk into the door. And so as with other skills, what we really recommend is not waiting until you're in a meeting facilitating to think about which skills you might use, but really to think about some of the questions you might ask in advance to allow everyone to participate and to allow for some disagreement. So before we close, we were hoping that in the chat, everybody could share both one thing that they learned in this session that they'll carry forward and one feeling that they're having after this discussion. And by chat, I mean Q&A.
We have some, give you a little bit of time and we can highlight some responses.
I love what you shared, Carly, that simple questions can be more inviting than open-ended questions. This is something that I have to actively think about just because of my clinical training. Open-ended questions are so baked into my repertoire.
I appreciate that Allison mentioned just thinking about new skills, and the feeling that you walk away with is empowerment.
And someone is going to try some of this at a scientific society meeting. Please let us know how it goes.
And I love, Rob walked away with, I feel hopeful that we can improve Discord connectiveness and a sense of belonging.
Well, we want to thank you all, even though we can't see your faces, for being here with us and for listening and for adding to the chat and participating.
And we are happy in the limited time to take some questions. We'll turn it back to Dr. Doherty and then also for Dr. Doherty to close.
Yeah, so if people have questions, you can throw them in the Q&A. We might have time for one, depends on the question. So let's see. This was a great session. I love all of the very practical tips and tricks for opening spaces and making them more inclusive. So thank you both very much for bringing that to us. So there's one question in here. We sometimes observe that growth follows a period of discomfort. How do we make space for discomfort?
Dr. Dow, do you want to start with that one?
Go for it. I see you smiling.
The piece that I'll recognize is one of my PCR groups, we struggled with really being deep in the conversations. And we were hearing a lot of feedback from the group and also noticing we had one session that it just fell flat. And so we actually took some time out of the regular agenda to re-talk about ground rules and for me and my co-facilitator to name it out loud and to name actually out loud how uncomfortable it was for everyone when we heard that feedback. And so just naming things out loud, naming the discomforts, and then working together, what can we do better? What can we do to commit? Did help us on that growth path. And I have to say, 4 months later, they were rocking it. And it just took some really turning inwards for everyone to think about, how did I contribute to this thing? And being in that discomfortable or uncomfortable space. I don't know if that answers the question.
Rob Althoff was asking about getting slides and if you're willing to share slides with us. I think what I could do is send them out to the listservs. So you need to sign up for the listserv, and we're going to I guess it needs to go into the Q&A, not the chat.
I just added a Dropbox link too, but might not be accessible to everyone. So both venues can do
here we go. That's great. Okay, but I still do want everyone to sign up for the listserv. Make sure you do that. And also, Jason, if you could put Lindsay's link into a way that everyone can see it, that would be great. Perfect. All right. So I want to thank everyone for being here. Thank you, Lindsay and Steve, for giving a great presentation. I feel like we need to do this again, and then maybe again, and then maybe again, and maybe do it in person where we can actually snowball and throw pieces of paper into the center of the table. I'm loving that idea. But thank you so much for coming and being a part of this. We really appreciate that. This is the last event for the academic year, but we'll be back in September. And in September, we're going to be September and through the fall and early winter, we're going to be talking about paths to leadership. And our first speaker will be Tiffany Love, who is a nationally known founder of the Love Leadership Foundation, but she also happens to be our chief nursing officer at Porter Medical Center. So she's one of our local celebrities and local experts. So stay tuned for that. Again, the listserv is how you can get the insider track on what's going on with gender equity and DEI. I want to thank everyone who's been involved with putting this on. This is the education work group, education and professional development work group off the Gender Equity Steering Committee. Joe Conant, who's here today, and Leanne Holterman. are the co-chairs of that group, and they put a tremendous amount of energy. Molly Berry is a part of the group as well. Thank you so much to Jason Towsley for being our AV specialist. Thanks to our closed captioner, and to our ODEI office staff, Emily Imarino, Krista Kohler, and of course our director, Tiffany Delaney, our Dean of DEI, Margaret Tando, and of course our Big D Dean, Rick Page. Appreciate all of you. So happy to be with you, and we'll see you again in September. Thanks everyone, and have a great day. Put your sweater on. It's a little cold out there.